Welcome to Startup Showcase, where I cover early stage startups that catch my fancy, and hopefully you find it interesting. This time I'm covering a startup called Salvo Health. It's based in New York, New York, my former stomping grounds. Sometimes I do miss Manhattan, and then I check the news and realize, nah, I'm good. Anyway, New York location. Obviously, it's got health in the name, so it's a healthcare startup. And its solution is that it enables doctors to provide wraparound care for chronic GI and metabolic liver conditions. So, wraparound to me sounds, for a simpleton like me, sounds like complete or integrated care. Somebody correct me, I'm sure you will if I got that wrong. Competitor analysis, that sounds pretty nichey, so I'm going to say not much there. It's probably already covered in a separate fashion, but not in an integrated fashion. Website is, and I apologize, I'll put it in the description. I forgot to actually put that on my list today. Product market fit, I would say it's questionable at this point. Seems relatively early since they've just raised $5 million of seed money. So open question there. The problem they're addressing is that it's all these treatments are broken into parts, and you're dealing with different people, and yeah, it's not a great experience. As a patient in other areas, I can tell you that when you are dealing with a multitude of people, and you don't have what I would consider like someone escorting you from digitally from one place to another, it makes you feel really alone, and it sucks. So I do think this is a good idea, to be honest, as a patient myself in a different area. Anyway, who are their customers? Well, the providers, not the patients. So VCs, City Light Capital, Human Ventures, as I mentioned, seed, pretty early. So there's definitely gaps in the information. Total funding beyond the 5 million, although I suspect there probably is. I couldn't find any mention of it. They're going to need patents for their software. And then market size, when you talk about healthcare, can always be sizable. So there's an opportunity here. And like I said, I would basically, think this is a good idea. I think there's an opportunity here, and that's why they were able to raise $5 million. But very early, room to stumble if they don't do this right. And so for us, we get to sit back, and hopefully, I hope they do really well. I think it'll be good for patients, good for doctors, and obviously good for them and the people who supported this startup. But remains to be seen. But I like the start. They're off to a good start, and let's root for them and hope they do continue to do well. Quick one today, but we'll keep going. Thanks much. Next time.